Up here, you can't see the trepidation on Merseyside from coronavirus infections that are rising alarmingly fast, though the Prime Minister says Liverpool isn't walking, or rather ailing, alone.
The number of cases has quadrupled in the last 3 weeks. There are now more people in hospital with COVID than when we went into lockdown on March the 23rd, and deaths are already rising. And of course, there are those who say that on that logic we should go back into a full national lockdown of indefinite duration. I do not believe that would be the right course.
So what is the Prime Minister proposing instead?
We will now simplify and standardise our local rules by introducing a 3-tiered system of local COVID alert levels in England, set at medium, high and very high.
So what are the new COVID-19 alert levels? Well, the medium level, the baseline for all of us, says that we can't socialise in groups bigger than 6 people, the so-called rule of 6, and pubs and restaurants have to close at 10 p.m. The high level says the rule of 6 applies only out of doors. Indoors, we can only mix with members of our own households or support bubbles. The very high level stipulates that all pubs must close unless they can convert into restaurants. There's no socialising with those outside of home or our bubbles, indoors or out of doors, except in a park. We shouldn't travel outside of the area, and outsiders shouldn't travel to the area. Finally, in the Liverpool City region, which is the only part of England to be classified high risk so far, the government has agreed with local leaders that gyms, leisure centres, betting shops, casinos and gaming centres will also close.
Keir Starmer.
It sounds severe, but Labour's leader fears the new restrictions may not be enough.
I'm now deeply sceptical that the government has actually got a plan to get control of this virus, to protect jobs or regain public trust. I know that there will be some on his side who will oppose further restrictions. There will be those that will look at the data and tell him to disregard it, or say the cost of acting now is too high. I want to be clear. The worst thing the Prime Minister can do is not act quickly and decisively enough.
Will the measures be enough?
Earlier, the Deputy Chief Medical Officer warned we should all be on alert.
The epidemic this time has clearly picked up pace in the north of England earlier than it did in the first wave. This is a nationwide phenomenon now that rates are changing upwards across the UK.
And then the Prime Minister turned himself into the pilot of the nation.
These figures are flashing at us like dashboard warnings in a passenger jet, and we must act now.
Are you saying that if it were not for the opposition of some mayors and local government leaders, other areas, especially in the north, would already be in the very high category?
We're working with local authorities across the country, but particularly with those badly affected regions that everybody knows about in the northwest, in the northeast. Yorkshire, Humber and so on, trying to work with them to support a collective package of measures.
But the Chief Medical Officer said shutting pubs on its own simply wouldn't do the trick.
I am not confident, and nor is anybody confident, that the Tier 3 proposals for the highest rates, if we did the absolute base case and nothing more, would be enough to get on top of it. We should not have any illusions. The idea we can do this without causing harm is an illusion. And every country in the world is struggling with this.
And what if the tough new restrictions don't work? Well, 3 special Nightingale hospitals for treating COVID patients, this one in Sunderland, others in Harrogate and Manchester, are coming out of mothballs, just in case. Robert Peston, News at 10.